Good morning, everybody. My name's Karen from Patient Concierge Services. We are running a tiny little bit behind. I've had messages from people saying they're struggling to get onto the link. So if it's okay with everybody, we'll just wait maybe like another 2 or 3 minutes and then we will begin. So sit tight and we're going to start soon. Okay, good morning, guys. Thank you so much for attending this webinar where we're going to discuss the Beyond the Stigma. And next to me, I have the amazing Dr. Wara.
Hello, Karen.
Board certified plastic surgeon, one of the latest surgeons to join BIMC Hospital in Nusa Dua. So just to kind of set you up for what's going to happen today, it should approximately last about an hour. But anybody that knows me knows that I can talk. So there's a little bit of a chance it might run over. So please be patient if that's okay with you. We have some fantastic guests on. We have the CEO and professor of BIMC Hospital, Jo Seller, and she's going to tell us a little bit more about her shortly. We also have Pamela Lovegrove, who is the founder of a Facebook group called Facelift in Bali, with a very powerful community in there. I think it's like 26,000 people now. We also have a gorgeous lady called Jennifer, who recently had a facelift by Dr. Wara, and she's going to come in and tell us about her experience, and we're going to have a little look at her before and after photographs. And then we also have another gorgeous lady called Rochelle Hall, who owns a business called Finance Your Surgery, and she's going to tell us a little bit about what she does and just join in this conversation around the stigma, and does it exist or doesn't it exist? Because I think it's a really interesting topic to unpick and just gain some different opinions and perspective on it. So I would really love to invite Jo on to give us a little introduction about who you are, what you do at BIMC, and then we'll show the fantastic video that you put together.
Good morning, everybody. Thank you, and welcome to everybody on this podcast. My name is Jo. I'm the CEO for Siloam Bali, and Siloam Bali incorporates 3 hospitals, and BIMC Kuta is one of them. Just to give you a bit of a history, I'm Australian by background. I've been running hospitals in Australia for many, many years, and in the last 6 months, I've taken up this role to manage our operations here in Bali. BIMC Nusa Dua, just to help you all understand, is a 35-bed, beautiful boutique hospital in a beautiful area of Nusa Dua here in Bali. We started in 2013. This particular hospital was built. It was operated by Australians, and it was bought over by Siloam a few years ago. We are accredited. We were the first hospital in Bali and Indonesia, and I'm going to say and Indonesia, to be accredited against the Australian healthcare standards. So for those of you who are concerned about our clinical capability, our ability to adhere to clinical excellence, I need you to be reassured that the standards that we operate here within the hospital are aligned with home. And I think that's important for people to understand and for people to hear. And so we've been accredited now by the Australian Healthcare Standards for the last 8 years, and it's a 3-year cycle, and we are going through our next organisational-wide survey in October of this year. We're also accredited by the Ministry of Health in Indonesia. And so from a clinical safety point of view, really important, I think, for our patients and future patients to understand how we work. So that's the clinical safety quality standards that I think I just need to get off my chest and for you to all hear. The other thing to also recognise is that our staff here, we recruit staff where English proficiency is a mandatory part of their employment. So all of our staff here, from our clinical staff to our domestic staff to our admin staff, all speak English. And that is also important for people to understand. So be comforted knowing that if you become a patient of ours, language isn't a barrier. That's important. Our surgeons, we're here with Dr. Wara. He is part of a group of plastic surgeons. Our surgeons have trained both within Indonesia, but they've got studies also overseas. So they come to you, and Dr. Wara comes to you with international experience. And I think, there is a bit of stigma around that. It's a bit of stigma around, what would Bali know? And I can assure you that the clinical standards, the clinical practice, the way that we approach patient care here is exactly like home. And I'm going to actually put it out there. It's the customer service and that private boutiqueness that we offer here is very, very good. So that's what I really want to say to you. We have a centre of excellence when it comes to cosmetics and plastic surgery. We have centre of excellences in orthopaedic surgery as well. So cosmetics is a part of what we do here. We have escalation of care processes, no different to what we have at home. And so clinically, you should feel no different if you're walking into a hospital in Australia. And Karen, I think that's what I really want to say at the outset. And I'm happy to filter any questions later on if the audience wants to ask me anything more. Thanks, Karen.
That's beautiful, Jo. Thank you so much. And I think that lines up really nicely with the topic today, where we talk about the stigma, because here at Patient Concierge Services, we've looked after hundreds of people now, and we've noticed patterns and themes, and some of our clients will say they didn't always tell their friends and family because their friends and family might have projected their fears onto them, like, why are you going to Bali? Because they have this misconception that it's not up to standards, or it's a little bit dated or whatever. So it's really good to hear that it's accredited by the Australian government and the Ministry of Health of Indonesia. So thank you so much for that. I would really love to show this video now, so this can hopefully put the cherry on the cake of what Jo's just said. Okay, bear with me.
Welcome to BIMC Cosmetic Center, where beauty meets expertise. Our center offers a wide range of services, from aesthetic treatments to plastic surgeries, all performed by experienced professionals. Blending medical science with the island's rich cultural heritage. Embark on a transformative journey to rediscover your true beauty with BIMC Cosmetic Centers, Plastic Surgery, and Aesthetic Services. Our team of experts is dedicated to helping you achieve your beauty goals, with personalized care and attention, inspired by Bali's philosophy of harmony and balance.
Hi, I'm Dr. Suka. As a plastic surgeon, I always do my best in surgery to deliver a satisfactory result for my patients.
Hello, I'm Dr. Astri. As plastic surgeon, I understand aging is a natural process, but we can choose how we age. I'm here, I always give my best to provide you beautiful aging journey.
Hi, I'm Dr. Indra, plastic surgeon. My priority is a patient personal care, and I believe that true beauty is not only a perfection, but it's a balance between harmony and confidence.
Hello, my name is Dr. Wara. I'm a plastic surgeon. My commitment is to provide honest, transparent, and personalized information to the patient according to their needs.
Specialize in a range of procedures, from facial rejuvenation to body contouring. Tailored to enhance your natural beauty and boost your confidence. We'll work with you to create a personalized treatment plan, addressing your unique concerns and goals to achieve the results you desire. From facelifts to breast augmentations and body lifts to liposuction, our skilled surgeons use the latest techniques to ensure a safe and smooth recovery.
My name is Luciana Barron. I live in Western Australia up in a small country town called Karratha, which we love. I was already prepared to be sick, but I just didn't expect that. I didn't even know that level of care existed. I've recommended to everyone that I could scream it from the rooftop.
Hi, I'm Melanie and I'm from Perth in Western Australia. Everything feels fine. I would recommend it because the facilities are spotless, very hygienic and sterile. I would say the technology here is up first class, so I would recommend it, yes.
Hi, my name is Chantel Patu from Perth, Western Australia. The medical staff are incredible, so the communication between the staff was excellent, and the communication between the staff and myself was also excellent.
But don't just take our word for it. Hear from our happy clients who've had experienced the BIMC Cosmetic Center uniqueness and discovered their beauty in Bali. Join the many who've discovered their true beauty and confidence with us. Take the first step towards your beauty journey today.
We work as a team to provide excellent care.
Ready to rejuvenate your beauty and enhance your confidence? Contact us today to book your consultation and experience the best of Bali's Beauty and Medical Center, BIMC Cosmetic Nusa Dua Hospital.
I absolutely love that video. If you like that video, just drop a little comment in the chat box. Just put a yeah, hell yes, or whatever you want to do. But isn't that a brilliant production of showcasing BIMC, where it's situated, all the doctors and nurses, and all of the amazing results? And obviously, Rochelle has joined us today, and she's also sporting her new facelift, and so is Jennifer. And it definitely is a bit of a work hazard for me because I'm like, what can I have next? When I see all of these gorgeous women having great results. Just a couple of quick points that I forgot to mention earlier is this is recorded. So for those of you that can't make it today, this will be then shared on YouTube. Hopefully everybody that has registered through the correct channels, you will have authorized us to then share this online. But if for whatever reason you do have any issues with that, please let us know and we'll do what we can to try and blur your identity. We do really welcome you to keep your camera on, but it's not compulsory. And also just keep your mics off until we invite you to ask a question. So over to patient concierge services. Who are we and what do we do? So we offer two main core services. The first one is we are a booking agent. So what that means is we don't work inside BIMC. We work as a third party externally, and we do a lot of marketing and a lot of promotions and interviewing doctors, and we do what we can to really raise the awareness and educate the audience on all of the different procedures that are available at BIMC. And then we invite people to book through us, where we manage that process, we manage the communication, we manage the paperwork, and if for whatever reason they're not getting back to us, it's me and my team that go in and jump up and down and say, please, can you reply? And so we take the stress away from the customer. However, we can only do this for brand new inquiries. So if you're already in the system, you need to continue communicating directly with the hospital. We receive a referral fee from the hospital for introducing new patients only. So that's service number one. The second service that we offer is care packages. So once you've got your surgery date secured, we create a care package. It is predominantly concierge, domestic, and non-medical. So what that means is we pretty much turn into your best friends, supporting you throughout the beginning, the during, and after your journey. So the most popular package that we have is 650 Australian dollars. And what that includes is about 7 or 8 different services. The first service is the virtual support, where you have your personalized WhatsApp group, where me and my team are communicating with you. You have this open two-way conversation, asking as many questions as you want. Even little things like, what do I pack in my bag? Or I'm feeling nervous. Or if it's your first time in Bali, what do I have to do to get through the airport and immigration? We can help you with all of that. Then we chaperone you throughout 3 hospital appointments, which is usually the pre-medical, the day of surgery, and discharge day. We will pick you up at your accommodation, stay with you throughout, and get you home safely and comfortably, and get you anything that you need, any shopping and all those kind of things. And it also includes 3 what we call home visits. So those home visits is where we do like a well-being check. So we check on how you are. Are you eating? Are you sleeping? Are you in any pain? Does anything need escalating? Do you need us to communicate with the hospital? And then we support you with the wound cleaning. So the wound cleaning is instructions that you get from your surgeon to do yourself, but we take that task on and we do it for you. And last but not least, if you have come to us through Pamela's Facebook group called F.I.B.P.R.E, you get a complimentary lymphatic drainage massage worth $40. So thank you for listening to that. And if you are interested, you'll get an email at the end of this webinar where you can inquire more. But just over to this topic, stigma. When Dr. Wara and I were chatting about wanting to do a webinar, we were like, what could we do that's a little bit different? It's not necessarily educational or a presentation. We wanted something a little bit more diverse. And we were both talking, weren't we, about this pattern that we've noticed, that there still is a huge chunk of women who really want to stay private and not tell anybody, or they face, uncomfortable probing questions from their loved ones, and they're coming from a place of love and concern, but sometimes they project their fears onto them. But then there is also a huge chunk of people that are very public about their decision to have cosmetic surgery and, take photographs, share it online, and don't really care about what anybody else says. So I just thought it was really interesting to pick it and pull it apart. There's another thing that I'd like to touch upon as well, which is something that I kind of personally debate with myself and what I see online as well, is I think there's a spectrum and there's a range. Like, when is it healthy? When is it a healthy choice to have cosmetic surgery? And when is it an unhealthy choice to have cosmetic surgery? So most of our clients are over the age of 50, and it's usually like their first or second procedure, and they've reached a point in their life where they're ready to invest in themselves and they want to refresh. They don't want to look anything different. They don't want to look 20 years younger. They just want to, pick up the skin that's kind of heading south and put it back up so that they look a little bit more fresh. But then you do see some people where they're on like their 12th procedure, or they're maybe slightly addicted, or maybe they're going a little bit too far. And I saw something in the press recently, I don't know if you guys have seen it as well, but Demi Moore is a beautiful woman and an amazing actress, and I have so much respect for her. But I saw an article of her recently. I think she's like late 60s, and she's just undergone I think another facelift and maybe something on her body, and she looks like she's trying to look 25. And now, while she does look pretty good, I felt a little bit alarmed when I saw that. I thought she looked frail. I thought she looked a little bit fragile. And considering she's just done the movie, The Substance, if anyone's seen the movie, The Substance, it's about somebody who's desperate to stay looking young, and how it can really mess with you psychologically. And, it's this crazy drug that they give to them and it reverses their age and blah, blah, blah. And it was so interesting that after that movie, she's now gone and got a load of cosmetic surgery. And for me, I just thought, well, when is it healthy to keep investing in cosmetic surgery? And when is it the right choice to embrace the aging and stay healthy? And obviously, any cosmetic surgery, whether it's any surgery, whether it's elective or whether you're being told to do it for a knee replacement or a hip, it comes with risks, right? So I don't know the answer. I just think it's something that we all need to be aware of. I'm 50 this year, and I probably had about 10 cosmetic surgery procedures. So I have to have a little chat with myself every now and then and be like, when do I just embrace the fact that I'm getting older and everything heads south eventually? So I'd actually like to start with Joe, if that's okay with you, Dr. Wara. Joe, I'd really love to know your opinion. Is there a stigma attached to plastic surgery?
Thanks, Karen. Look, I do think there is a stigma attached to plastic surgery. I don't think we could deny that. Do I believe personally that we're normalising the conversation, both in Australia? Of course we are. And I think having conversations about plastic surgery is a healthy conversation to have. Women, men don't embark on such a procedure lightly. And I think that that's important for people to recognise. I think as a clinician myself personally, there is a lot that people overcome mentally to embark on a journey. And not only just embark on a journey, say at home, and I say home, I mean Australia, but to embark on a journey overseas is a huge thing for any individual to take on. I think, and I think our doctors in particular have a recognition that it's not just around the cosmetic look where patients make a decision. It is around mental health. It is around wellness. There are a number of things that go into a decision like this. And I think we stigmatize it socially, falsely, to be honest, because we don't see behind the face. We don't see behind the breast or the arms or the ears or whatever decisions people are making. There is a lot that our patients emotionally go through. And I think the more we have this conversation, I think the more we recognise people's decisions to undertake cosmetic surgery, I think the less stigma there will be around this. So there is no doubt that it's there, but I dare say there is no doubt that stigma involves anything. And I think the more that we recognise the rationale that sits behind people's decision, I think the better it will be. So I hope
Yeah.
that answers your
Yeah.
question, Karen. Yeah.
Yeah, I think that's a really, really good point, is the rationale behind it. And I think that's the bit that really dictates whether it's in the healthy zone or the unhealthy zone of whether you should do it or not. So understanding the rationale is, okay, is this going to improve my confidence? Is it going to improve my life? Like, so for example, I went and had body surgery done, and it did transform my confidence and my life. Like before then, I would never want to wear a bikini, and now I love wearing a bikini. And for me, that was a health thing to do. But it's so interesting because if somebody compliments on my body, I still have a bit of shame. I still have a little bit of, oh no, but it's fake. Or, oh no, but like, what if I meet this guy and you're like, oh, she's got a nice booty. And I'm like, oh no, will he not like me if he knows that I've had a fat transfer? Like this, it's still a very interesting debate, I think, even internally or for other women is, yeah, it's our body, it's our choice, right? Yeah, yeah. And if you had somebody very close to you who you loved said they were getting cosmetic surgery, how would it make you feel?
I think we've all either ourselves individually or we know of people who've embarked. It's very rare that we probably don't know people who've been in this particular position. And I think as human beings and part of humanity, I think it's people's choice at the end of the day, as long as it's safe, as long as it's done properly. I mean, that is why I'm here, to make sure that, clinically everything is done right. And it's about respecting people's decisions. At the end of the day, there is an element of respect here. For the people on the call, Karen, we've treated over 1,000 Australians last year.
Oh my God.
In this space. And for me, it is about respect. A patient's choice is a patient's choice. For me, it's about respecting the choice that they've made. And hopefully the outcomes are what that patient desires. I mean, our surgeons, Dr. Wara, it is around aligning people's goals to make sure that the outcome that they receive is not fake. It's not fake. We're not going to make a 50, 60-year-old 21. It is about ensuring that, and it is about people's expectations as well, about, what do you really want to get out of this? And how will it make you feel? I think there's a lot of emotion that goes into that. I think there's a lot of image that is also part of this. I mean, me personally, I encourage anyone to do whatever they want. If it makes them feel better, do it. And we are here clinically to help you. That's what we're here for.
Yeah. Yeah. I think that's it. Yeah, absolutely. Beautiful. Okay. Thank you so much, Joe. Dr. Wara, I'd love to hear your opinion.
Okay.
So you've obviously treated hundreds of people now so far. Do you think there's a stigma attached to plastic surgery?
So I think there is still a stigma, but from the recent years, maybe like 30 years recently, so it's decreasing.
It's decreasing.
Yeah. So a lot of people that know that there's a self-aware about their body perspective and also their image of their beauty.
Yeah.
So a lot of people right now is doing the plastic surgery. But still there's a stigma around that one. So they are still like Karen said. So a lot of people still like afraid that hide that the fact that they are still do the operation. So they hide it that I did the operation. So there's still something.
Still something there.
Yeah.
Yeah. Obviously, I would never reveal anybody's names, but I find it very entertaining that sometimes we have wives that don't tell their husbands.
Yeah.
And it's like the husband picks them up at the airport and he's like, wow, you look great. And she's like, yeah, that yoga retreat was amazing. So in terms of the spectrum that I was talking about earlier, like the healthy choice, and do you think there's a time where it's unhealthy for somebody to have plastic surgery? Like you have to take into consideration their mental health, right?
Okay. Yeah, I agree with that one, especially during this social media boom.
Yeah. All
Also,
influencers.
and all of the influencers
Yeah.
share that experience, and also a lot of hospital, a lot of the beauty clinic and something like share that before and after, and some that is make like a lot of patients have like an unrealistic expectation.
And it's probably a filtered image.
Yeah, so yeah, it's probably a filtered image in this area of
Yeah.
AI, yeah, something like that. So they don't filter the information. They just say, oh, I can look at like this. As Karen said that when you are at the 60s, so you want to look like 20, something like that is something like unrealistic. But because of the social media boom and maybe less information that they search about it and they don't really well informed about the procedure. So they have like an unrealistic expectation. So it's one of the problem also for me. Yeah. And also, yeah, this is alarming also. So
It's alarming,
yeah.
yeah. So I guess when you're doing your face-to-face consultation, this must be part of the criteria is you have to manage their expectations, like getting ahead of the conversation to say, look, this isn't going to freeze time. This isn't going to take 40 years away. This is just going to refresh who you are now. Yeah, so that must be quite a hard conversation sometimes.
Yeah, it's quite hard, but we have to match our expectation, my expectation to the patient and the patient also expectation to the result of the operation. So it's very important. So that's why it's the stigma right now is not only you not do or do the surgery, do or not do the surgery, but you have to be well informed about it.
Well informed about it. Have you ever had a patient that's come to you and they want, let's say an example, they want a facelift and they absolutely don't need it and you've had to say no?
Yeah, it's sometimes because because of the social media. Yeah, because usually on the early age, something like below 40, they say that, oh, I really look tired and something like my cheek is already decent and there's laxity of the skin, something like that. When I do the teleconsultation and the consultation also, I see that I don't think you need it.
Okay, good. I love that you say no and you've got the confidence to say no. And I think that's what makes BIMC really stand out as well, as you prioritize the patient's care, even if it means turning away the money. Brilliant, thank you. I would really love the audience to get involved with their questions now. And when you registered, you did send a question in advance. So I've got a few picked out. So if it's okay with you, interestingly, all the questions are around plastic surgery, not around stigma. So we're going to go off topic a little bit, but I'd really love to invite, sorry, one sec. Maureen Bainbridge, if you're on, would you mind unmuting your mic and ask Dr. Wara your question?
So I have quite a severe TMJ issues on both sides, but really badly on the right. And I'm looking at having a face and neck lift. Would that impact the decision? Would my jaw impact that decision on, would it affect it?
Okay, so thank you, Maureen. So I will try to answer your question. So yeah, you have like a TMG problem, right? The temporomandibular joint problem, especially on the right side.
Yeah.
So is that any limitation when you open your mouth or close your mouth or something like that?
Yeah, I've had an MRI and I've got the discs are displaced and not going back into the socket, and I've got a chronic long-standing effusion, and yeah, it's bad. Yeah.
Okay. Yeah. So actually, it's not like a like absolute contraindication for the TMG joint, the surgery for the face and lift surgery. Yeah, you have to know that the surgery of the face and neck lift is mainly involve the tissue, the skin, and also the muscle. So it's like not below or in the bone. So for the surgery perspective, it is safe to do it. So it's in the TMG is also the joint and also the bone is quite far from our dissection or the surgery in the surgery field. So it's okay. But the concern is when we do the preoperative. So because we have to do it in the general anesthesia. So we have the intubation. So it's we have to make sure that everything is safe because we will, so how is your opening the mouth and something like that, because we have to make sure about it. So if it's okay and based on our the blood test and based on our anesthesiologist evaluation. So if everything is okay, so you can proceed to the operation. So it's from the medical perspective, it's not like a absolute contraindication. As long as it's especially on during the intubation, during the general
Yep.
anesthesia. So we have to make sure is everything is okay to do it. So because we have in the general anesthesia, we have to put the tube.
Yep. Yep.
Yeah, so it's one of the only one concern, but for the surgery, because it's like far and it's quite far, we don't like manipulate the joint or manipulate the bone inside of it. So I think it's okay. Yeah, it's safe to do it as long as
Right.
when they do the intubation, the concern is.
Okay. Thank you.
Yeah, welcome.
You feel like your question's been answered, Maureen?
Yeah, absolutely. Yeah. Thank you.
Thank you for giving us your question. Could we invite our next Rebecca Hunt to share her question?
Yes, hello, this is Rebecca here. I think I gave a question earlier about brow lift. That was one question, but I've also just popped one in the chat about an optimal age. I see a bit of debate about this on the Facelift and Bali site, but I'm sort of heading towards 53 and a fair bit of skin laxity. And yeah, just wondering, how long do you leave it so you only have to do it once, or do you get in early and then plan to do it twice? So that's one question. And then the brow lift and what's involved in endoscopic brow lifts. Why that they seem a little bit more complex and not too many people do them. Why is that?
Okay, thank you. So I will try to answer the first question. So actually, there are no like exact age for what is the age that you are like suitable to do the facelift operation. It's depend on the personalized condition. So sometimes it's below the 40. I think it's usually for our aging of the skin and also the soft tissue is starting above the 40 years old. So it's depend. So sometime around like after like 40, the condition of the face is already showing the aging process like cheek descent, and also there is a jowl and laxity of the skin. So as long as there is so as long as there is a sign of that aging process, so we can proceed to the surgery. But if it's like a minimal, so you have to know that there are a lot of options before we can do like a full facelift, something like that. So you have to consider maybe like to do the non-surgical rejuvenation. So if it is like minimal laxity, something like that, so you try to rejuvenate. But if you have to know that if we perform like usually here I perform like a deep plane face and neck lift, a lot more deep structure. So if we perform it in the early age, sometimes it's quite invasive. So we can like choose another option like mini facelift, something like that. So it's depend on the
Like the
condition,
condition,
the
yeah.
condition of the skin and the face. And also for the age, is usually if there is like only minimal laxity, something I suggest to do only like mini facelift is okay. But if there is like also there are some patients that say that they want to they have like more laxity, but they want only do the mini, like something like that. So I tell the patient it's not ideal. So maybe the result is not it is still improvement, but there's still the laxity of the skin, something like that. So for the next question, for the endoscopic brow lift, so you have to know that the brow lift, there's many option of the technique that we can use. So one of the technique is the endoscopic brow lift. So it's using like a camera, we call the endoscopic. So there will be like a small incision behind your hairline. So we will put the camera inside. So because of there is a camera inside, so we don't do like a blind dissection, something like that. So it can minimize the swelling and the side effects. So because we clearly see there is a nerve and there is a muscle inside, so it's more safe and more maybe the recovery process is faster. So that's why the indication for the endoscopic brow lift. But yeah, because of the using of the device, it's not like a blind, so it's more complex in the technique of it. But yeah, but it's more safer because we can see it, the nerve clearly and all of the stuff. And also usually for the direct brow it's the scar will be like minimal because we there is like 3 or 5 incision involved. It's like behind the hairline, so it's more the scar will be not that visible because it's only the small scar.
Perfect. Thank you so much.
Beautiful. Thank you for your 2 questions. We're running a little bit over, so I'm just going to invite one more person to ask a question. Mary, are you on?
Yes, I am. But to be honest, I can't remember what question I did ask because
I've got it here for you, one sec.
yeah.
How long before and after surgery do you need to come off blood thinners?
Okay.
Right.
Yeah, so this is a nice question. So because when every consultation, I will ask all of the medication that you take. So particularly if you took like a blood thinner, so there is a specific consideration. So you have to know also that there are a lot of type of blood thinners, different type of blood thinner and different like time that you have to stop. But it's like there is an aspirin, like clopidogrel, and also like a warfarin. There are wide varieties of the blood thinners, but usually for the blood thinners, it's advisable to stop it usually like 1 week before the operation, because if you took the blood thinner, there is a risk of the bleeding when we do the operation. But it's depend on the medication. Sometimes with the aspirin, we can stop like 3 days before the operation is safe. But it's like warfarin and something that more bigger dose, so we have to stop it for a longer time. But I think it's better if you consult to your doctor first about is it safe to stop it for a while. Yeah, so but it's usually like 1 week it's safe to stop it before the operation.
Do you mind if I jump in? Is arnica considered a blood thinner?
So no,
because we get asked this question all the time,
okay.
and I get different answers off different doctors.
So arnica is not like medically like it's like
It's
homeopathic.
supposed to reduce bruises,
Yeah,
right? Yeah.
homeopathic medicine. So yeah, arnica is like not like it's not like a medicine. It's like
Herb.
herbs. Yeah. So yeah, the main there is like also debate about it.
It's a
But
debate, yeah.
but still some research say that there's improvement of the bruising and can make the bruising less. So yeah. So for the arnica, so because it's like a herb, so I think there are no harm in that. So if you're confident to take it after the surgery, I think
Okay, beautiful.
Okay.
Thank you so much. Thank you so much for
I was just that with that, because one of the reasons that I was concerned, I mean, I have spoke to my hematologist and GP and vascular surgeon actually, and because I was put on blood thinners because I had deep vein thrombosis on a flight to Bali, which is only a 6-hour flight. But I was stented and it was all fixed up. But normally, because I am booked in for deep plane facelift in June. And I'm flying about 2 days beforehand. And normally on the flight, that's probably the one specification that the doctor quite likes me to stay on them. And all 3 of those professionals said, normally 2 or 3 days beforehand. But obviously, I'm guided by, what the actual surgeon who's doing it suggests.
Beautiful. Thank you so much for all your questions, everybody. If you've sent your question and it hasn't been answered, please email us and Dr. Wara will answer your question on email and I'll send that over to you. But we're just going to try and stay on track. So we have 3 more amazing women that we want to chat with. But next, I would love to invite in Pam. So Pam is the founder of a really powerful big community called Facelift in Bali. I think everybody has heard about it, and sometimes I go for coffee with Pam and she's like a celebrity that gets stopped on the street. So Pam, I would love to know, why did you start the Facebook group Facelift in Bali and when?
I started it 2.5 years ago, and I think the catalyst really was I lost my husband very suddenly, very unexpectedly. And after about 12 months, I still felt as if the grief was etched onto my face. It wasn't just something I felt. You could see it when you looked at me, and I could see it. So I went to investigate having a facelift. After, I must say, I went to see an aesthetic doctor at first, and he said, no hope for you. You've got to have a facelift, which was a bit of a shock. But when I started investigating it, there was just no information about. And I thought, I'm just going to start a Facebook page because I had visions, and I know I've shared this with you before, Karen, of these. Gossiping is a full-time job for some people here. And I said, when they're all sitting at the beach having their coffee or their cocktails, and someone says, do you think Pamela's had any work? I want someone to say, of course she has. It's all over Facebook. She's posted every gory detail. So that's why I started it. And we started with, I think, about 10 or 12 of my close friends at home and about another 20 of the prime gossipers in Sanur. And now in 2.5 years, we're at 26,000 people. So obviously there was a need for it. I don't think we've managed to take the stigma away entirely, because a lot of people are reluctant to post because they, getting sidetracked here with the message. A lot of people are reluctant to post in case someone sees it, because as you know, they don't tell anyone. And the other thing, which is I hate, but I've got to do it because so many people want it, is to allow people to post anonymously, and also with these ridiculous, I don't know who's got the job of making them up, those nicknames that people use, you know,
Violent box.
Fainting Flamingo 456, you know, wants to know something. And we don't ever recommend surgeons. We say, you know, you have to do your research and choose your own, because if something, God forbid, were to go wrong, I don't want anyone coming back and saying, but you said. So, yeah, that's why I started it, but it hasn't completely solved the problem, but I think it has allowed people to get information. And we're always saying, do a search. There's heaps of before and after photos, heaps of surgeons mentioned, and the ladies, although we try to encourage them, if they're not 100% happy, not to mention anybody's names, but they can message each other.
Yeah, I think your group has just helped thousands of women. You know, it's like I've noticed with patient concierge services is a lot of the women come to me and they've kind of, I say, danced with the decision for a couple of years. But then once they've been inside your Facebook group for a little while, because of other brave women sharing their story, they then like, oh, come on, I want to do it. And I think
a lot of people say that to me, message me and say, I never would have done this if I hadn't come across the page. Yeah. And I don't know how they come across it, quite frankly, because it's a private page. But
well, it's interesting actually. I don't know if I've ever told you this, but when I moved to Bali from England, within my first 3 months of being here, I wanted to get some cosmetic surgery done and I couldn't find anything online. And I flew so backwards, from England to live in Bali, and then I flew from Bali to Istanbul. I got my work done there, flew back to Bali, recovered, and then I found your group, and I was like, "Oh my God, why didn't I find your group before I spent $5,000 on flights?"
I've just got a Gojek to BIMC.
I know. I was like, I've just spent like 20 grand in Istanbul, and I
Quicker
could
than
have kept it in
going to the
Bali.
airport.
I know. So thank you for the group. Thank you for inspiring everybody, and thank you for sharing your story. And obviously, we're really sorry about your husband. And you know, you look gorgeous. You know, how old are you, Pam? If you don't mind us.
Thank you. I'm in my mid-70s now.
You look
so
incredible.
As far as the age question goes, it really is just at any age.
Yeah.
When you feel you really need it, providing your health obviously is the main concern.
Absolutely, yeah.
I have since nothing to do with my surgeries, just a wicked lifestyle all these years.
Yeah.
Just had a heart attack, which was managed beautifully in Bali.
Yeah.
And so that's the end of cosmetic surgery for me for a while. I've got a stent put in May, and I have to keep taking all the blood thinners.
Yes, please keep taking them. We need
They
you.
know.
Fit and well and
I
healthy.
think I'm on the lot.
The
I
lot.
only have
Do
to
you rattle
carry
when you
my
walk?
bag, and I've got a bruise.
I know. Oh, bless you. Yeah, you have to prioritize your health. Okay, thank you so much for sharing. Next, I would love to invite a lovely lady called Jennifer. And Jennifer has recently had a facelift by Dr. Wara. Let me just try and share some before photographs. Although, if I'm really honest, how do I find these before photographs of Jennifer? They're on my desktop. Sorry, everyone. My beautiful assistant is helping me. Yeah, this one. Oh, okay. Yeah. So she's obviously already gorgeous. Hang on, I don't think it's showing. Wait. Can everyone see that? No. Now? Do you know what? Let's scrap it. Let's just invite Jennifer on. Okay. You can see it now? Okay, awesome. Yes. So the Indonesians are blessed with beautiful skin, right? As you can see, she's already gorgeous. Her neck is still in pretty good condition, and her skin, but obviously ever so slightly her jowls are starting to appear. And you know, she's a very beautiful lady, face on, not too many wrinkles, and she just wanted a refresh. So she come to Patient Concierge Services. She told me what her desires would be, and we introduced her to Dr. Wara, and she loves you. She's booked in for 3 surgeries this year, and is having a full transformation from head to toe. And she started with her facelift. So Jennifer, would you mind coming on and telling us a bit more about your experience?
Let me start. I'm Indonesian, but in that time when I started search the plastic surgery as an option, I live in Sydney. I began to observe that years ago, the observed noticeable change in my face, like a sagging skin, especially my neck. I was not happy at all. And then through the Facebook, I tried to join several Facebook support surgery, plastic surgery. And then I searched from there, and then I found PCS. And then I contacted, and then I had the first appointment Zoom with Karen. So I explained it to Karen what I want, and I explained it also to her that I'm what they call it. I don't know the exactly name in medical, trypanophobia, the one that person who afraid of needles.
Yeah.
So I asked Karen, find me a surgeon that must be very patient and can really calm me down of my fears. So Karen recommended me Dr. Wara. And then I flew to Bali in December. As a person that afraid of needle, I think I need to have face-to-face appointment. And then Dr. Wara answered all my questions, and somehow she can assure me that the surgery is not really that bad that I was thinking, you know. So then on the 19th of February, I had surgery for facelift and neck lift. And I was really relaxed before surgery. And then PCS really took care of me. Santi was my primary caregiver. She picked me up in the airport, and then she looked after me. She took me to all the appointments, and then after surgery care, that, you know, she came every morning to help clean my wounds. My experience with the surgery, I could say I didn't feel pain at all. It's discomfort, yes, especially on the second day after surgery, when I feel was very tightened on my neck. So the nurse had to cut a little bit of my breath because I couldn't breathe. I couldn't breathe, so I had to call it. I had to call the nurse. But aside of that, I didn't feel pain at all, and my wound heals nicely. I don't have any swelling. I think it's except here, maybe the tightness, but I don't have a bruise. I could say it. And this is my first day out of the Garmin compression in the daytime. I just feel a little bit sensitive towards sun, so I just made sure I wear the big hat when I even just get out from the house. So I think I can encourage the other ladies to do the surgery, because actually it's not as painful as I thought.
Yeah, I think the mind can play tricks on us, can't it? Like, you know, we really almost anticipate this traumatic, like big event, but actually most of our patients say it's never as bad as what they think. And I mean, looking at you, it's like, what, just over 2 weeks ago?
Yeah, 2 weeks.
That's incredible. I mean, look at your jaw and your neck. Is she healing well, Dr. Wara?
Yeah, it's healing. She's healing very well.
She looks gorgeous. Do you mind us sharing your age?
I'm 63 years old.
Oh, you look amazing. Absolutely. Are you happy with your results?
Yes.
Yeah, brutal. And what's next on the agenda?
I think Dr. Wara told me to come back in 3 months for the mommy makeover.
Mommy makeover. So that would be breast augmentation and the body.
Yeah.
And then 3 months after that, is it the thigh lift?
Yes.
Yeah.
And then I would have a ear reconstruction, because my ears are not similar. This one is, you know, bigger than the other one. So Dr. Wara recommended should be done the last one.
The last one. Yeah. And you're an expert with reconstruction. I remember this from when I interviewed you. Yes. Yeah.
Yeah, that was one my consideration when I chose Dr. Wara, because I read the explanation that he's a reconstructive surgeon.
Yeah.
So for me, that most important than the others.
Yeah. Yeah. I know. I interviewed Dr. Wara 12 months ago, and I remember really noticing his creativity and as an artist. And you play the piano as well?
Yeah.
Yeah. Like he's a very, very talented
I'm
man.
not a pianist.
But he's, but you have like the architecture of artistry. So yeah, Jennifer, you look incredible. Thank you for being brave and sharing with us all. I'm sure you'll inspire many women. So thank you so much.
Thank you.
Beautiful. Okay, so we are running over, but thank you so much for everyone's patience. We've just got a few more things to cover, if you don't mind just sticking with us. So one of the obstacles that I've noticed is the financial side of cosmetic surgery. And I've noticed different reactions from different people, them saying, if you can't really afford it, you shouldn't do it. Or sometimes you have people that say, well, I can afford it, but I might not want to touch my savings, or they feel guilty for spending the money. So I'd really love to have a little chat with Rochelle, because she's been in the finance business, I think, for like nearly 22 years. And she's going to share a little bit more about her business and how she, some of the experiences. So Rochelle, would you mind coming forward and telling us a little bit more about you and what you offer, and, what's your opinions about people spending money on cosmetic surgery or taking a loan?
Yep, can you hear me?
Yes, we can hear you.
Okay, cool. Hi, everyone. Before I get started, I just wanted to actually pick up on something that Joe had said earlier. So I actually wrote it, I took a note of it, when she said that the clinical standards in Bali are just the same as in Australia. I actually beg to differ. My experience is that they're better in
Oh, yeah.
Bali. And that's coming from someone who's had 8 lots of plastic surgery in Australia, and then my facelift and upper blephs in Bali. So yeah, I just wanted to say that. I wanted to point that out.
How many weeks has it been since you had your surgery at BIMC?
I'm 4 weeks and 1 day.
You look incredible. You look amazing. Look at your beautiful jaw.
Yeah, I'm just so happy. I'm out of all the surgeries I've had, this one has by far been the best for me. But yeah. So yes, I have been in the finance industry, and I'm going to keep this short and sweet because I know we have run over time. I've been in the finance industry for 21 years now, with a special interest in financing cosmetic and plastic surgery, although I do all sorts of types of finance. And one of the most common things I come across is women who have actually got the money in the bank, but they're just absolutely not willing to touch it. And the reasoning they usually give for that is they feel that that is the safety net for their family. So if something goes wrong with the kids who are at high school, or, you know, something goes wrong with hubby, or there's some sort of, you know, emergency around the house, like the solar breaks or whatever it might be. So they just don't want to eat into that buffer. So I see a lot of that. I think there is still a little bit of guilt around financing the procedures. Although I do feel that's become less and less over time, especially when they realize that it's actually not a huge amount that's coming out of the family budget per week. When it's broken down like that, all of a sudden they get that comfort around there. But, you know, just on the topic of stigma, I do think it's still there. And I say that because almost every single one of the conversations that I've had with these women when we're putting their finance in place, I'm hearing comments like, I just don't know what my work colleagues are going to say. My mother-in-law told me that it's selfish. And I do feel like the stigma is still more around facelifts as opposed to things like breast augmentation, which you know, have been really, really common for 2 decades now. So many women have had breast augmentation, but facelift is new. Or new for many. Certainly up and coming though. So yeah, look, I do believe that their stigma is out there, but pages like Pamela's, so the F.I.B.P.R.E page, I think it's definitely helping to address the stigma. I think it's bringing women together. I think it's encouraging conversation, and all those things are healthy. I won't go, like I said, too much into the finance side of things because everyone's financial circumstances are different, and that means different outcomes. I deal with over 40 different funders, and it really is about determining what someone's situation is, what their needs are, what their desires are, and from there I can help them to make a decision as to what might be right for them. Yeah.
Mind if I just jump in a second? Because
Go ahead.
That's one of the first questions that I always get is, how much is the whole thing going to cost me? And like you say, there's so many variables to take into consideration. So let's just pick like the most popular one. So if somebody was to have a facelift with Dr. Wara, which I think is around 9,000 Australian dollars, BIMC partner with a fantastic hotel, which is like 2 minutes from the hospital, called Grand Wiz. And that ranges from, I think, maybe like $100 a night to $250 a night, depending on the, you know, the style of the room. And then obviously we would want a care package built into that from PCS. So let's say, for example, it's 12,000 Australian dollars for somebody to have surgery, have the decent hotel, have PCS, and they wanted to pay that off in like 2 years.
As a package?
What would that look like?
Yeah, okay. So the finance that I do, because I'm a broker, it's what we call risk for rate. So if I have a client who's been in their job for 2 years, has a good credit rating, if they've got a mortgage over their own home, that's actually a positive, believe it or not.
Okay.
Statistics actually say if someone has a mortgage over their home, they're less likely to default on a cosmetic or plastic surgery loan compared to someone who's renting. But renters obviously get finance too. I guess what I'm just saying is, with risk for rate, the stronger the application, the cheaper the interest rate. So when I give you this repayment amount, I'm just going to go ballpark like right in the middle.
Yeah.
For a package like that. So we would probably be looking at, just bear with me, and I'm also going to do it over a 5-year term.
Okay.
So that is actually the most popular. Terms range from 1 year to 7 years, but it's important to remember that there are no early exit fees or penalties for paying it off faster. So even when someone thinks, oh, look, I can easily clear this in 2 years, quite often they'll take a 5-year term because it gives them the flexibility on months where cash flow might be a little bit tighter to pay that lesser amount, but then they can pay double or triple at other times. So yeah, if we look at a $12,000 package and we were doing it over a 5-year term, then we would be looking at weekly repayments. I'll do these weekly because most people think weekly, $57.
Oh my God, you spend that on coffee and cake.
Yeah, absolutely. Absolutely.
You wouldn't even notice it, would you?
We can't even go to the supermarket now and put half a dozen items in the trolley for that amount of money. Like
No.
it's one Uber Eats, it's one pizza night. Yeah.
That's
And
incredible.
at the end of the day, plastic surgery is not just about the external. It's about the internal.
Yes.
Like it really is about internal. If you feel good inside, like everything in life just works so much easier and so much better. And for me, that is what it's about.
Yeah, I agree with you. I say when you look good, you feel good.
Yes, and it's true.
You can wait. Very quick story. I had a patient. It was a gentleman actually, 6'5" from New Zealand. Looked like he could tear a man in two pieces, and he was getting blepharoplasty. So nervous, and he said to me he'd been dancing with this decision for 2 or 3 years, and every time he looked in the mirror, he was wasting energy, disliking what he was seeing.
Yes. Yeah.
Like the bandwidth that you waste on going, oh, every time you look in the mirror, it's like my boobs are heading south. It's like if you change that energy into now I love what I see. It's just going to transform everything, right?
Every single morning before I had my facelift for the last few years, every morning I've stood in front of the mirror and I've done this to like pull the gels up.
Yeah.
When I'm at the hairdresser and the mirror is right in front of me, same thing. I'm like, oh my goodness. And now I get up and I look in the mirror and I'm like, oh my God.
Yeah.
Like I love what I see now. So yeah, it's definitely just as much, if not more, about the internal, I
And
believe.
how old are you, Rochelle?
47.
Wow, you look gorgeous.
47, 10 procedures in and I ain't stopping yet.
I'll
be back to Bali shortly.
I say it's like decorating your house. You can't just do the one room.
Absolutely.
Beautiful. Thank you so much, Rochelle. Right. Okay, guys, hang in there. I've just got 2 more things that I need to cover. Thank you for your patience. So the next 2 things that I want to cover is, first of all, everybody who's purchased a ticket for today, your 150,000 Indonesian rupiah, which is approximately $12-13, went towards Bali Hounds Helpers. So this is the street dogs, street cats. And actually, I have a really lovely story to share. So me and Santi, who own PCS, there was a dog by our office. And my heart was breaking every time I saw this dog. Her ribs were on show. She was timid. And I was like, oh my God, look at this poor doggy. And the timing of us finding this little doggy whilst generating money from this webinar, I ended up speaking to the founder of the charity and saying, do you mind if whatever money I raise for this webinar, we put towards this dog? And she said, yes. So let me show you where your money has gone. So let me show you Dolly. Her name is Dolly. on my desktop, this one. Oh, that one, that one. Okay. Can you see that? This is little Dolly. As you can see, she's lost all her fur. Her ribs are on show. She's tiny. She's timid. So me and Santi were feeding her for maybe a week to 10 days every day, just taking her some leftover chicken and some dry biscuits. And then what was really sweet is some locals saw us helping this dog and they started to join in and they built a little shelter for her. And then after about 10 days, I was like, okay, let's help Dolly. So we've raised, I think, around $350. So this is where she was sleeping, bless her. As you can see, she's already put on weight from the first image because we were taking food to her. And this is what she looks like now. So it was really hard to get a photograph of her because she's bouncing around like a little fox. Her tail's always wagging and she's put on weight and all of her fur has started to come back. And this is her in my home because I've somehow accidentally took her home with me. But she's now being sterilized. She is, look at her. Oh, she's giving me all the kisses. And put a little tracker on her collar. So she lives outside the front of my home at the moment because she pees everywhere. When I say hello to her, she pees on my feet and I haven't got time to train her just yet. But she's putting on weight. Her fur is coming back. She's been sterilized. All of the parasites in her blood are being treated. Any infection she had is being treated. So thank you guys for your donation. This is Dolly the dog who you have saved. Okay, last but not least, we did say that we're going to pick 3 winners to have a complimentary one-to-one consultation with Dr. Wara. So hopefully you're still on the call. The 3 winners are Rebecca Hunt, Maureen, and Sandra Batchelor. So what we're going to do, hang on, my assistant's giving me a note, one moment. We're going to send you a new link for you to join. Join immediately after. What about one by one? Which one first? Yeah. Rebecca, are you still on? Okay, I'll send you all the link. And then if you could just wait because you're gonna be in a row, 1, 2, 3, you'll all get 10 minutes each. So wait for a message to reach your WhatsApp now from Josephine, who's my assistant. And that is it, guys. We are finished. So thank you so much. I hope that you found this interesting and inspiring and informative. And if you'd like to know more about PCS, Dr. Wara, the other plastic surgeons that are here, an email will go out to you approximately, I think, what time is it scheduled? 12 p.m. we have an email scheduled to go out to all of you. There will be a registration link in there if you want to know more, and we can tell you more about the costs, hotel packages which BIMC have secured, and obviously care packages us from BIMC. But thank you. Please enjoy the rest of your Friday. We really appreciate your time that you've given us here today. And Dolly the dog says, thank you. Oh. Thanks, everyone.
Bye-bye. Okay, let's go. Bye. Yes, we have to